Thank you so much, Dr. Meltzer, for that lovely introduction. And good evening, everyone. It's wonderful to be here with you tonight to speak on the psychology of pain. Some of you may have an understanding of the interplay between pain and psychology, while others may be exploring this connection for the first time. Wherever you're starting from tonight, my goal is to leave you with a deeper understanding of how pain works and what you can do about it from a psychological perspective. This lecture will focus on 4 main areas. First, we'll explore why pain is more than just a physical sensation. Pain isn't just something that happens in the body. It's shaped by a complex interplay of biological, psychological, and social factors, and we will use the biopsychosocial model to unpack that. Second, we will dive into the science behind chronic pain, touching on why pain sometimes persists long after an injury has healed. Third, we'll address some common myths about pain during the lecture. Some misconceptions about pain can be really disempowering, so we'll tackle those and provide some clarity. And then finally, we'll discuss practical tools for managing pain. You'll learn about different evidence-based psychological approaches and interventions, as well as some of the best self-management resources that we are often recommending to folks who come through our clinic. So with these objectives in mind, let's start by defining what pain is and how it works. So the International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. What's important here is that pain is not just a sensory or physical sensation, it's an emotional experience. This means pain involves not only the signals our body sends, but also the feelings and reactions that come with it, which are really important elements when it comes to the treatment of chronic pain. You can also think of pain as your body's warning system, designed to grab your attention and drive you to action to protect yourself. For example, if you touch a hot pan straight from the oven, the immediate pain that you feel ensures that you quickly pull your hand away to avoid further injury. This system is an evolutionary and adaptive response to perceived or actual danger that has helped humans survive for millennia by preventing further harm and changing our behavior to protect us. However, in chronic pain, this warning system can become overactive, sending pain signals even in the absence of actual or immediate danger. So this is where the brain and nervous system's role becomes essential in addressing persistent pain. So now that we've discussed how pain acts as the body's warning system, it's important to recognize that pain is much more than a biological sensation, as we just discussed when looking at the definition of pain. It's not just about what's happening in your tissues or nerves. It's also shaped by emotional and contextual factors. We call this the biopsychosocial model of pain, which considers the biological, psychological, and social factors that influence pain. On the left, on the biological side, we have factors like tissue damage, age, genetics, system dysfunction, inflammation, medical conditions, effects of medications, sleep, diet, and exercise. These are often what come to mind when we think about pain, and they're certainly an important piece of the puzzle. However, they are not the whole story. We must also consider psychological factors because we know that pain is an emotional experience, and psychological factors play a significant role in shaping how pain is perceived. So these include things like your thoughts, beliefs, and meaning that you assign to pain sensations. For instance, how you think about your pain, whether it feels manageable or overwhelming, can influence how severe it seems. If pain is seen as something that you have no control over, it can feel more intense and distressing, while a sense of control can help reduce its impact. Other psychological factors include things like coping behaviors, memories of past pain experiences, stress, past trauma, emotions such as fear, anxiety, frustration. And we'll talk about these factors more in depth in just a little bit. And then finally, when we think about pain, it's also critical to consider the broader context of someone's life and the social factors that influence their pain experience. So these factors can include things like environment, relationships, cultural identity, and access to resources, all of which shape how we perceive and cope with pain. For example, someone with a strong social support and a stable environment may experience pain differently than someone who feels isolated and has limited access to care. And it's really the overlap of these three areas, the biological, the psychological, and social, that shapes one's overall experience of pain. And because these factors interact, effective pain management often requires addressing all three domains rather than just focusing on one. And this is why a multidisciplinary approach to pain management is often the most effective. So here at the Stanford Pain Clinic, this concept forms the foundation of how we treat chronic pain. By addressing pain from multiple angles, we can create a comprehensive and individualized care plan for each person. So this slide illustrates this multidisciplinary approach using the analogy of a three-legged stool, where each leg represents a crucial component of pain management. So the first leg is the medical approach. Those are going to be things like medication, injections, surgery. These treatments often target the biological aspects of pain, which is helpful, especially when pain is driven by inflammation, nerve damage, structural issues. Again, these are the first things people think of when addressing pain, and they can play an important role in reducing symptoms. The second leg focuses on psychology and behavior. So that includes things like evidence-based techniques, such as relaxation exercises, activity pacing, mindfulness practices, and other things that we'll talk about shortly. So these strategies help individuals regulate their nervous system, reduce stress, and reframe unhelpful thoughts about their pain. And this leg of the stool acknowledges that empowering patients to take an active role in their pain management can significantly improve outcomes, as well as reduce the emotional and mental burden of living with chronic pain. And the third leg is the physiological therapy and movement, which includes activities like physical therapy, yoga, tai chi. So movement is a key component of chronic pain treatment because it improves strength, flexibility, and overall physical functioning. Importantly, it also desensitizes the nervous system by showing the brain that movement is safe, which can reduce the intensity of pain over time. The key takeaway here is that there's no single leg of the stool that is most important, and typically we need all three of these legs to stand strong. So just as a stool needs all three legs to remain upright, chronic pain management works best when medical, psychological, and movement-based approaches are integrated into a care plan. And this multidisciplinary approach we have found not only addresses the complexity of pain, but also tends to lead to better outcomes and improved quality of life from individuals with chronic pain. Now, what's important that we distinguish is acute versus chronic pain. So here at the Pain Clinic, we are typically helping individuals manage chronic pain, which is the focus of this presentation. While acute pain is an important part of the body's natural defense system, what we'll be talking about today is a far more complex and persistent condition that requires a different approach to treatment. I do want to explain the difference between the two. So acute pain is short-term, and it acts as the body's natural warning system. That warning system I spoke about earlier. It is typically caused by something specific, like an illness or an injury, and its purpose is to protect you by signaling a need for rest or action to prevent further harm. For instance, if you twist an ankle, that pain is going to encourage you to stop moving and give the area time to heal. Once the healing process is complete, the pain resolves. This type of pain is adaptive and protective, ensuring that we don't inadvertently worsen an injury. Chronic pain, however, is a different experience entirely. It's long-lasting, often persisting beyond the expected healing period, and can even occur without any identifiable ongoing injury. Chronic pain might be triggered by an illness, an accident, or sometimes the cause is unknown, but it continues long after that original issue has resolved, if there was one. For example, someone might experience persistent lower back pain for years, even though no active injury is present. This is also why chronic pain can't be effectively treated by the same approaches used for acute pain. Instead, it requires this multidisciplinary approach that we discussed earlier, one that addresses not just the physical, but the psychological and social factors. So now that we've discussed the distinction between acute and chronic pain, let's explore why pain becomes chronic. So chronic pain isn't simply pain that lasts longer. It involves significant changes in how the brain and nervous system process pain signals over time. The process starts with the nervous system becoming more reactive. This is called sensitization. Repeated pain signals condition the nervous system to respond more intensely, even to stimuli that wouldn't typically cause pain. For instance, light pressure or normal movement might begin to feel painful because the system is on high alert. Over time, persistent pain reinforces and strengthens pain pathways. So you can think of these pathways like trails in a forest. The more they're used, the more defined they become, and the easier it is for signals to travel along that pathway. This makes the nervous system more effective, so to speak, at experiencing pain, even when it's no longer helpful or necessary. And finally, the brain learns pain. This is perhaps the most fascinating and complex part. It's not just about that neurons become more responsive to stimuli and that the pathways are strengthened, but that the brain becomes primed to expect and generate pain signals. The brain essentially rewires itself, making it much more likely that we're interpreting and perpetuating those pain signals. So these changes are why chronic pain is so complex and why it requires more than just treating the site of the pain. It often is not about the original injury at all. In fact, most often, it is how the nervous system and brain have adapted over time. So understanding this can help us tailor treatments that can retrain, so to speak, the nervous system and reduce pain over time. So building on what we've discussed, it's crucial to understand that all pain, whether acute or chronic, is processed in the central nervous system, the brain and the spinal cord. The pain you feel, whether it's a stubbed toe or chronic back pain, is not merely a result of tissue damage. It's the brain's interpretation of signals it receives. Brain is not just a sensation in the body. It's a complex output generated by the brain in response to perceived threats or danger. So pain isn't just this passive experience where the brain receives signals from the body. Instead, the brain actively evaluates these signals, combining them with these factors like your previous experiences, emotions, and the context of the situation. So this evaluation determines the intensity of the pain that you feel, or whether you feel pain at all. For example, if your brain perceives a situation as threatening, it's much more likely to amplify that pain response. So one striking example of this is phantom limb pain. In this phenomenon, a person feels real pain in a limb that is no longer there. So this underscores that pain isn't always tied to a physical tissue. It's tied to the brain's perception of danger or threat. The brain creates the experience of pain based on its interpretation of what's happening, even when no signals are coming from that part of the brain. So again, the key takeaway here is that pain is more than just a physical sensation. It's a complex experience shaped by the brain, shaped by our brain. And this understanding opens the door to treatments that target the brain and the nervous system, helping to kind of turn down the pain response by changing the brain's interpretation of those brain signals. But I want to make sure to emphasize that pain is in your brain, but it's not all in your head. This distinction is super important because when we say pain is processed in the brain, it can sometimes feel invalidating to folks living with chronic pain, as if we're suggesting that the pain isn't real. However, that couldn't be farther from the truth. Your pain is very real. The image on this slide highlights a critical point. So pain is generated by the brain based on how it interprets sensory, emotional, and cognitive inputs. The brain acts as this control center, processing pain signals that travel from the body through the spinal cord and determining the intensity and the nature of the pain experience. What's fascinating is how this process involves multiple areas of the brain. For example, on the screen, you'll see the feeling center processes the emotional component of pain, how the pain makes you feel emotionally, like fear, frustration, distress. Then you have the thought center, which handles the cognitive aspect, what you believe or think about your pain, such as whether you feel it's manageable or overwhelming. And these brain regions don't just process signals passively, they influence whether pain feels more or less intense. The metaphor of gates is helpful here. So these gates, which exist at the level of the spinal cord and brain, regulate how much pain information is allowed to reach the brain. Think of these gates as volume dials for pain. When the gates are open, pain signals flow more freely and the pain feels more intense. This can happen during periods of high stress, anxiety, or when negative emotions dominate. The brain perceives greater threat, amplifying the pain experience. When the gates are closed, fewer pain signals get through, reducing the experience of pain. And this can happen when the brain feels safe, supported, and calm, during moments of relaxation, mindfulness, or positive distraction. And the key takeaway here is that understanding that pain is a brain-generated experience doesn't diminish its reality. It empowers us to explore ways to influence those gates and reduce the intensity of pain over time. So let's dive into our first myth or fact of tonight to reinforce some of what we've just learned. So many individuals living with chronic pain hold the belief that their pain means that their body is permanently damaged. Now, this belief is understandable because pain often feels like a direct indicator of harm. After all, with acute pain, that tends to be true. It's typically tied to an injury or illness, and it resolves as the body heals. But is that true for chronic pain? So this is a myth. Chronic pain doesn't necessarily mean there's permanent damage to the body. The reality is that pain can persist even after tissues have fully healed, and in some cases, chronic pain may not stem from tissue damage at all. In fact, the underlying cause of chronic pain is sometimes unknown or related to factors outside of physical injury. But what we do know is that regardless of what caused that initial pain, chronic pain is often driven by these changes in the nervous system that we've discussed. This is why, again, chronic pain isn't necessarily a sign of permanent damage. It's a reflection of how the nervous system has adapted over time. And again, understanding this can be incredibly freeing because it shifts the focus from fixing damaged tissue or body parts to strategies that calm and retrain the nervous system. To further illustrate this and the complexity of pain, I'd like to share two compelling case studies, often referred to as the tale of two nails. So in the first case study that was published in the British Medical Journal, there was a construction worker who jumped onto a plank with a nail that pierced straight through his boot. Naturally, he experienced excruciating pain and was rushed to the emergency room where he was sedated and prepared for treatment. However, when the doctors at the hospital removed his boot to examine the damage, they discovered something really shocking. The nail had passed cleanly between his toes without breaking the skin. There was no tissue damage, no blood, no wound, nothing. And yet, his pain was very real. So what happened? His brain, responding to sensory input and contextual information, perceived a serious threat. The sight of the nail in his boot, combined with potentially dangerous work environment conditions, and the reactions of those around him, his coworkers, triggered a cascade of emotions, fear, panic. And based on this context, his brain guessed that his body was in danger and generated pain to protect him. So this example demonstrates how pain can arise entirely from the brain's perception of threat, even in the absence of actual physical harm. The second case study provides a stark contrast. So another construction worker was using a nail gun. It accidentally discharged and sent a nail directly into his face. Apart from a mild toothache and some bruising, he thought he had escaped this incident unscathed, and he continued to work, eat, sleep as usual. And then about a week later, he went to the dentist, where an X-ray revealed that a 4-inch nail was embedded in his skull and had pierced his cerebral cortex. A very serious and potentially life-threatening injury. But why didn't he feel more pain? So in this instance, his brain lacked the sufficient contextual cues to recognize the threat. So without visual confirmation of injury or immediate alarming symptoms, his brain essentially decided that the situation wasn't dangerous, minimizing his pain response despite the severity of the injury. So what do these two cases tell us about pain? So first, pain is not an accurate measure of tissue damage. As we've seen, you can experience intense pain without any injury and very little pain in the presence of significant harm. This highlights a critical distinction. Hurt and harm are not the same. Second, pain is the brain's best guess at whether the body needs protection, based on the sum of biological, emotional, and contextual inputs. Fear, attention, and social cues amplified pain in the first case, and their absence dampened pain in the second case. So once again, these examples emphasize the importance of comprehensive pain management. So the next time we think about pain, it's important to remember it's just a guesstimate. It's your brain's best attempt to protect you, even when there may be no physical threat still occurring. So this one might feel straightforward given everything we've discussed, but let's address a very common belief that pain is always a sign of physical injury or damage. It's easy to see why this assumption exists. After all, when we feel pain, it often comes from an injury, like a cut, a burn, a bruise, or a broken bone. So it makes sense to connect pain with physical harm. But the question is that always true? Is pain a direct and reliable indicator of injury or damage in the body? And the answer is no. Pain is not always a sign of physical damage. The truth is that pain is your brain's way of interpreting danger, and it doesn't always correlate with tissue damage. We just saw this illustrated in these case examples. The construction worker who felt excruciating pain from a nail that didn't injure him, and another who barely noticed the severe damage caused by a nail in his skull. These examples clearly show that pain and injury are not always aligned. And as we've discussed, pain is processed in the brain, and the intensity of that pain can be influenced by many biopsychosocial factors. So these factors act like a volume dial. They can either amplify or dampen the experience of pain. So I wanted to go over some of these factors. So some of the factors that can increase the volume of pain include things like unhelpful thoughts. So unhelpful or negative thought patterns about pain include beliefs like, this pain will never go away, or I have no control over my pain. These thoughts may seem harmless at first, but decades of research have shown that they can significantly worsen pain outcomes and even reduce the effectiveness of medical treatments. Persistent unhelpful thoughts, along with the emotions that they generate, like fear, frustration, or hopelessness, create a feedback loop that amplifies pain perception and keeps the nervous system in a heightened state of alert. Inactivity or overactivity. So inactivity leads to muscle weakness, joint stiffness, and overall deconditioning, which makes normal movement more difficult and painful. On the other hand, overactivity, doing too much on good days, or pushing through the pain, can lead to flare-ups, reinforcing the cycle of pain. Poor sleep and nutrition. So poor sleep disrupts the body's ability to repair itself and regulate pain perception, leaving the nervous system in a heightened state of reactivity. Similarly, a diet high in inflammatory foods can promote systemic inflammation, which sensitizes pain pathways and worsens overall pain experience. Stress is a big one. So chronic stress activates the fight or flight response, which floods the body with stress hormones like cortisol and adrenaline. And these hormones can heighten pain sensitivity, making the nervous system hyperactive, and even minor things can trigger those pain signals. So addressing stress is critical. Fear and anger. So fear of movement or fear of worsening pain can lead to avoidance behaviors, which decondition the body and amplify pain over time. Similarly, anger, whether at oneself or others or the situation, activates the brain's threat detection system, leading to an amplified pain experience. Depression and anxiety. So depression creates feelings of helplessness and hopelessness, which can exacerbate pain by making it feel overwhelming and inescapable. Anxiety, on the other hand, keeps the nervous system in this kind of constant state of hypervigilance, heightening pain sensitivity and increasing the likelihood of flare-ups. Past trauma. So past trauma, abuse, neglect, injury, or ongoing trauma primes the nervous system to remain on high alert, making it more reactive to pain. And this heightened state of arousal can lead to the brain interpreting even normal bodily sensations as threatening, which again amplify pain. Isolation, so a lack of social support, increases feelings of loneliness and emotional distress, which can intensify the experience of pain. Isolation can also deprive you of connection, validation, encouragement, which are crucial for managing chronic pain. And then finally, on the left-hand side, we have medications. So misuse or overuse of certain medications, for example, opioids, can lead to increased pain sensitivity, where the nervous system becomes more sensitive to pain over time. Similarly, dependency on medications without addressing underlying psychological or social factors can limit our belief in our own ability to cope and can limit progress. So on the other side of this, on the right-hand side, you'll see factors that can turn down the volume on pain by promoting a sense of safety and calming the nervous system. So they're kind of the opposite of what you see on the left-hand side. So thinking positively or in a hopeful mindset shifts the brain's focus from danger to safety. So positive reframing, like this is challenging, but I can manage it. And gratitude practices reduce the brain's threat response and promote the release of endorphins, which naturally reduce pain. Instead of under or overdoing it, pacing activities, adopting a balanced approach to activity prevents that cycle of overexertion and crash that we often see. Setting achievable activity goals and gradually increasing physical activity reinforces confidence in the body's capabilities and signals to the brain that movement is safe. Quality sleep and nutrition. So restorative sleep allows the body to repair tissues, reset stress hormone levels, regulate emotional responses, all of which help reduce pain sensitivity. Similarly, a balanced diet is going to support overall health, reduce systemic inflammation, calm the nervous system, lowering stress. So stress reduction techniques, things like mindfulness, progressive muscle relaxation, deep breathing, we'll talk about some of these, are going to signal safety to the brain. And regular practice of these techniques is going to reduce cortisol levels, which decreases the nervous system's reactivity over time. Positive emotions, joy, love, happiness, laughter, gratitude, these are going to stimulate the release of endorphins and dopamine, which act as natural painkillers. Treating trauma. So if you have unresolved trauma, treating that in therapy is going to reduce the nervous system hypersensitivity that we see and help the brain process past experience and release the emotional toll that those may have. And this is going to allow the nervous system to return to kind of a baseline state and decrease pain perception. Engaging in pleasurable activities, so activities that bring joy or purpose or pain. So these activities also reinforce feelings of safety and promote positive neurochemical changes that reduce pain intensity. Building a social support network. So feeling connected and supported by others reduces emotional distress and provides a sense of safety, calming the nervous system. And so the supportive environment acts as a powerful kind of gate closer by counteracting the isolation and fear that can amplify pain. And then finally, medications is going to show up on both sides here. So when we use medications appropriately and as part of a multidisciplinary approach, certain medications can help modulate pain. For example, medications can help stabilize the nervous system and allow other biopsychosocial interventions to take hold more easily. Again, these are things that you'll want to discuss with your doctor, but certainly can be helpful for some. So now that we've discussed how various factors can turn the pain volume up or down, let's take that understanding a step further by looking at the internal processes that play a significant role in this. So our thoughts, emotions, and behaviors. So these aren't just abstract concepts, they're key drivers of how we experience pain day to day. So what we think is our beliefs and interpretations about pain. How we feel is related to those thoughts that we're having about our pain and the emotions those thoughts elicit. How we behave, these thoughts and emotions often affect our behavior, so either in a positive way or a negative way. So this slide illustrates what we call the cognitive behavioral therapy, or CBT, pain cycle, which is this self-reinforcing loop connecting thoughts, emotions, behavior, and chronic pain. And understanding the cycle is crucial because it's highlighting how our internal and external responses can either exacerbate or reduce the experience of pain. So let's go through an example of how this might show up. So what we think, for example, someone might have the recurring thought like, I'm damaged, or my pain will never get better, or nothing can help me. These thoughts are going to send danger signals to the brain, reinforcing the perception that the body is in constant threat. This in turn heightens pain sensitivity. How we feel. So these negative thoughts that I just mentioned can trigger strong emotions. Stress, anxiety, anger, fear, frustration, sadness. These emotions amplify the pain experience by keeping the brain on high alert, reinforcing the idea that something is wrong. In response to these thoughts and feelings, individuals may withdraw socially, avoid physical activity out of fear, may stay in bed for long periods of time. And while these behaviors might provide short-term relief, they often lead to negative long-term consequences. So that can lead to things like physical deconditioning, reduced social support, feelings of isolation, all of which can worsen chronic pain. So how does CBT intervene in the cycle? It works by disrupting these patterns at any of these points. So we can change thoughts. So CBT can help with identifying unhelpful thought patterns, reframing them in more constructive perspectives. For example, instead of thinking my pain will never get better, someone might reframe that to, I have tools and strategies to help me manage my pain effectively. Regulating emotions, so that more balanced thought is going to in turn impact how we feel about our pain. We might feel more hopeful, we might feel more optimistic, which is going to adjust our behavior. If we feel more in control of our pain and optimistic that we have tools that can help our pain, we're going to be motivated to use those skills. For example, instead of isolating, we might be encouraged to engage in gentle movement or reconnect with our social support network. And these changes can have a cascading effect. By breaking the pain cycle at any point along the way, we can reduce emotional distress, promote healthier behaviors, and ultimately help turn the pain volume down. And this is why CBT is such a core part of our treatment approach. So in this clinic specifically, we offer an 8-week CBT group specifically designed to address chronic pain. This group provides a structured way for patients to learn these skills, practice them in a supportive environment, and build a toolbox of strategies that you can kind of carry with you after the group ends. And this is just one of many different ways we approach pain management in the pain psychology clinic, but it's often one of the first methods that we might go to. So I just wanted to describe that in more detail for folks today. But if you want to explore these principles in greater depth, I highly recommend that you check out our YouTube channel, where Dr. David Talavera has an excellent lecture that delves further into these CBT concepts. So, as we've been discussing, the role of psychology in chronic pain management is ultimately about turning down the volume on pain. This slide highlights the same factors we discussed earlier: stress, emotions, sleep, nutrition, social support, thoughts. But now we're going to focus on some of the ways in which we might address these factors in treatment. So stress is going to keep the body in that fight or flight state, which we talked about. So we might address that through relaxation techniques, progressive muscle relaxation, deep breathing, which is going to calm the body's fight or flight response. Mindfulness practices are another core approach to reducing stress and bringing that nervous system back into balance. Emotion, so fear, frustration, anger, that often come with chronic pain can heighten pain sensitivity. So we work with patients to identify and process these emotions, sometimes through cognitive reframing, which we just looked at with the CBT, sometimes emotional validation or acceptance-based strategies. For thoughts, so unhelpful thoughts such as catastrophizing or helplessness are major contributors to pain. So through CBT, we guide patients to recognize patterns that they may engage in and replace them with more balanced thoughts. This shift reduces the brain's perception of threat, which can decrease pain sensitivity. Again, this is just one way we might approach thoughts depending on the treatment approach. We might address sleep and nutrition by establishing a sleep routine, prioritizing consistent wake times, limiting screen use before bed, or referring folks to our All About Sleep group. Similarly, we educate patients on proper nutrition and help reduce pain sensitivity over time. With respect to social support, we know that chronic pain can be isolating, which worsens both emotional and physical distress. So we encourage patients to build or reconnect with their social support networks, whether family, friends, or support groups. Feeling supported is really critical in reducing emotional and physical pain. And though not purely psychological, movement is a vital part of treatment. So activity pacing is a tool that we teach to balance movement with rest. Again, these are just examples which are not comprehensive, but rather some of the possibilities of targets for treatment. And through these approaches, we help patients take an active role in their own care. The majority of the work actually happens outside of sessions or groups when folks apply these things in their day-to-day life. So it really takes a level of commitment with the idea that through the work, you will be able to lower your brain sensitivity to pain and hopefully gain more control over your pain in your day-to-day life. So now that we've explored the factors that influence pain and strategies to turn down the volume, I'm just going to dive into a few specific psychological treatments we offer in this clinic. Each of these approaches targets the biopsychosocial aspects of pain and is designed to help patients take control of their pain experience. So pain neuroscience education, this is often the starting point. By learning how pain works in the brain and the nervous system, you can demystify the experience of pain, reduce fear, and build a foundation for further strategies. You're doing that today, so congratulations. We also offer a class called Empowered Relief, which is a 1-session, 2-hour class designed to give you kind of an immediate toolkit of strategies to calm the nervous system and manage pain. This class is based on the latest research in pain neuroscience, was created here by Dr. Beth Darnall here at Stanford, and is a great way to start your journey towards better pain management if you have not gone through that class yet. We also have the CBT group that I mentioned earlier. We have an acceptance and commitment therapy group, which focuses on not changing your thoughts like cognitive behavioral therapy, but emphasizes accepting difficult thoughts and feelings while committing to actions that align with your values. We also provide biofeedback on an individual basis in our clinic, where you can learn to regulate your body's physiological responses, such as muscle tension, heart rate, and breathing. And with the idea being that by gaining control over these responses, you can calm your nervous system and reduce pain intensity. Mindfulness-based stress reduction, such as involves things like meditation, body scanning, to help you become more aware of your body and respond to pain with less reactivity. So this can lower stress and help close those pain gates. And mindfulness is really incorporated in many of the other treatments that I'm mentioning today, because it's really just such a core and important tool for chronic pain management. We also offer pain reprocessing therapy. So this is a newer approach that focuses on helping you reframe your pain as a false alarm generated by the brain. By reducing fear and altering how your brain interprets pain signals, pain reprocessing therapy can reduce pain for some individuals. And you may have heard about this treatment if you have read The Way Out by Alan Gordon. We also will begin offering emotional awareness and expression therapy. This therapy emphasizes the connection between unresolved emotions and physical pain. So with the idea that by helping patients identify, process, and express emotions, you can reduce the nervous system's hypersensitivity and alleviate pain. And then we also offer hypnosis, which can help you enter a deeply relaxed state where you're more open to suggestions for pain relief and can shift your focus away from the pain experience. Each of these therapies is tailored to meet individual needs, and often we find that combining approaches is the most effective way to address chronic pain. So we would do this by evaluating you and tailoring a comprehensive care plan to meet your unique needs. So if you're referred to our clinic, you would undergo an evaluation with one of our providers to identify the most appropriate treatments based on your specific circumstances and goals. So back to our myth or fact. So many people believe that medications and surgeries are the only path to managing chronic pain. This belief often stems from the medical model where we're all likely more familiar with, one that emphasizes treating symptoms through physical interventions like prescriptions or procedures. And again, while these can play an important role for some, they are not the whole picture. Pain is complex and it's a biopsychosocial experience, and successful management often requires addressing the broader context of what drives pain. So this broader approach to care recognizes that pain exists within the entire person, not just the body. So the truth is, this is a myth. Psychological and physiological therapies are well supported by research as effective tools to complement the biomedical approach to pain management and even reduce the need for things like medications or surgical interventions. And while medications and surgeries have place for some people, the good news is that you have more options and you're not just limited to relying on those for relief. For our last myth or fact, we talked about this, but the idea that psychological therapy is for pain, I mean, it's all in your head. So this belief leads to a lot of confusion or skepticism about the role of psychology in pain management, especially the cases where maybe you were never referred to pain psychology until all the medical interventions didn't work. And then you're thinking maybe my provider just thinks this pain is fake or it's in my head. But what we've discussed so far is that pain is processed in the brain, but it's not imaginary. It's not all in your head. And psychological therapies focus on addressing how the brain processes pain signals. And these approaches are grounded in neuroscience and aim to help regulate and modulate the brain's interpretation of pain. So all of this to say, psychological approaches like those used here at the Stanford Pain Clinic complement, but they do not replace medical treatments. So this is just a summary of what we've talked about today as we wrap and we make time for questions. Pain is not just a physical experience. It's influenced by biological, psychological, and social factors. These elements interact in a complex way to shape how pain is perceived and managed. Second, your brain plays a pivotal role in either amplifying or reducing pain signals. It acts as a processing center. Third, pain psychology offers tools to help turn down the intensity of pain by addressing these amplifying factors. Techniques like CBT, ACT, mindfulness, and other interventions that we talked about today can empower you to take control of your pain experience. And then finally, effective pain management relies on a multidisciplinary approach by combining medical treatment, psychological strategies, and physical therapies. We can address pain from multiple angles. So as we come to the end of the presentation today, I want to highlight some valuable resources that can support you in managing chronic pain and apply what you've learned here today. These tools are designed to complement the strategies that we've explored and empower you to take an active role in your pain management. So first, we have the Curable app, a highly recommended app that uses evidence-based techniques like pain neuroscience, education, mindfulness, CBT to help you address and understand your chronic pain. It's accessible. It offers practical strategies that you can do at home. There's a lot of free resources in this app, and there's also a paid subscription version that gives you an access to a larger library of exercises, expert interviews, and other features. We already discussed the Empowered Relief class. If you're interested, get in contact with your pain provider here and they can refer you. Tame the Beast is a free online series of videos that explains the neuroscience of pain in an engaging way. So I encourage folks to check that site out. The Insight Timer app offers thousands of guided meditations, sleep aids, and breathing exercises to help manage stress and promote relaxation. So I encourage folks to download that if you're interested. It is a free app. And then finally, for deeper scientific insights, the Huberman Lab podcast featuring Dr. Sean Mackey, a leader in pain management here at Stanford, discusses tools to reduce and manage pain. This resource is great if you're interested in understanding the interplay between neuroscience and pain management. It's much more lengthy and comprehensive view of chronic pain. And then finally, and feel free to screen grab any of these. Just going to highlight very quickly so we can have time for questions. Some excellent books that delve deeper into science and psychological management for chronic pain. These are highly recommended books for anyone looking to better understand their pain. And most of them are tied to some of the interventions we talked about today. So for more pain neuroscience education, I encourage folks to look at the Pain Survival Guide. For pain reprocessing therapy, folks may want to look at The Way Out by Alan Gordon, which focuses on rewiring the brain's perception of pain by shifting it from a threat response to one of safety. And so it can be a powerful guide for retraining the nervous system. We also have Unlearn Your Pain by Dr. Howard Schubner, which provides a structured program rooted in psychophysiological pain management and mind-body medicine. And so it's going to address the psychological and neurological roots of chronic pain. We also have mindfulness-based stress reduction with the Full Catastrophe Living down at the bottom there by John Kabat-Zinn, which is foundational for mindfulness-based stress reduction. Living Beyond Your Pain is tied to acceptance and commitment therapy, and it introduces ACT and encourages you to focus on living a meaningful, values-based life despite pain. And then we also have Integrative Pain Management with Less Pain, Fewer Pills by Dr. Beth Darnall here at Stanford, which is going to tie together multiple approaches like CBT, mindfulness, and going to help folks reduce dependence on medications. So each of these books are great. And then we also have some additional classes and group resources. I'm going to leave this up for folks. Feel free to screen grab it. We offer several pain psychology classes with a referral from Stanford pain management provider, assuming that they are an appropriate fit for you. For education and support, we also have we have this lecture series, which you know about because you're here. But this meeting is held on the first Monday of each month. So you can register and share this resource with loved ones at the link provided. Recordings of past lectures are available also on our YouTube channel. And then those looking to connect with community, you can find that on the right-hand side. So the Bay Area Chronic Pain Management Migraine Support Group and the Men's National Chronic Migraine Support Group offer supportive spaces to share experiences and gain insights from others living with chronic pain. There's also the Miles for Migraine Community Support Group. And then additionally, you can explore opportunities to engage in research down at the bottom. So with that, I encourage you to take advantage of all of these resources and reach out if you have any questions. I also see that we have launched the poll for tonight. I encourage folks to fill that out and provide feedback. That will be super helpful as we prepare for our next lectures. So thank you very much. And I do want to make sure that I get to the questions, but I want to make sure that Dr. Meltzer doesn't have anything to share.